That jaw pain has some legs. It can go to your ears, your eyes, it can give you dizziness, teeth pain, tinnitus, all kinds of things. Hey, let's say you've done my exercises, you've meditated, you've gone to soft foods, you've forgiven everyone in your life, you're sleeping better, and let's say you still have some pain. Well, I gotta tell you a secret. I'm using it on my people, and it's amazing. It's called the Piezowave. It's right here. It uses low energy focused shock waves. You know, I adjust the skull bones, I adjust the mandible, I'll do some muscle work, get people on my videos. But as far as getting into the actual temporomandibular joint and breaking up scar tissue and regenerating tissue, this thing is amazing. We can also go into the masseter and soften it up. I'm Dr. Adam Fields. I'm a chiropractor. I work a lot with TMJ. Let me share with you how this works. The National Institute of Dental and Craniofacial Research classifies TMD, or temporomandibular dysfunction, as myofascial pain. This is a common form of TMD. It results in discomfort or pain in the fascia. This is the connective tissue that covers the muscles, and muscles that control the jaw and neck and shoulder function. This can come from chronic grinding or clenching when you sleep. Even like stress in your life that you're not resolving can increase the tension in your jaw. There's also degenerative joint disease. This includes osteoarthritis in the jaw joint. Osteoarthritis consists of bone spurs, also subchondral sclerosis, or thickening of the bone under the cartilage, and then cartilage degeneration. Internal derangement is another thing they talk about. This means dislocation of the jaw or even a displaced disc. The NIDCR also says because evidence is lacking for the majority of TMD treatments, experts strongly recommend staying away from the treatments that cause permanent changes to the jaw joints, teeth, or bite, or that involve surgery. But what about the Piezowave? Can it help? Can it harm? How does it work? Well, what we do is send low energy focused shockwaves. And when I say focus, I mean we can do 0.5 centimeters to 1.5 centimeters, just sending a blade of sound exactly into the joint, breaking up any adhesions. And actually we get neovascularization, which is new blood supply in the area. And then it stimulates fibroblastic activity, right? We get new collagen formation. So if there's arthritis, we can actually, which is decreased joint space, we can actually increase the cells in there, which eventually can increase that joint space. I mean, the first time I read this, I'm like, no, that's not real, right? And then you read another article and another article and another article, and it actually helps regenerate the tissue. Let's look at this article now on how that would relate to the myofascial changes, the myofascial pain, like in your masseters, for instance, which are so tight. Efficacy of extracorporeal shockwaves in the treatment of myofascial pain syndrome. A total of 571 patients were included in 8 studies. The pain level after ESWT was lower than that after other treatment methods, which included trigger point therapy, pulsed radiofrequency, dry needling, and other therapies. And the pain threshold after ESWT was higher than that after other treatment methods. I love winning. How about those tight muscles? Here we go. Low energy versus high energy versus radial shockwave therapy. Low energy shockwave therapy. Realize this is low energy shockwave therapy, which is different than high energy. High energy requires anesthesia, and the anesthesia can actually interrupt with the healing process, has been shown. Also, there's radial shockwave therapy, which you don't want anywhere near your jaw, that's for sure. Whereas the waveform is completely different, and it's highest right at the skin level, and then it just spreads out. Whereas this wave is focused, much better. With the radial shockwaves, we used to be bruised and scabbed when the reps would come in and show it to us. Not that great. Low energy shockwave therapy for the treatment of myoglosis of the masseter muscle. So we're talking hypertonic jaw muscles for a long period of time, months. 50 patients with painful, palpable, and sonographically evident myoglosis of the masseter muscle. Half had a single session of ESWT and half had a placebo. It was shown that in 64% of the patients, significant alleviation of pain with palpable and sonographically evident softening of the myogelosis could be achieved. The difference from the placebo group was statistically highly significant. This is amazing. One treatment, right? Most of my people, when we're working on this, we're coming in for 6, 12, 18 treatments. I mean, one treatment, and they got 64% of the people had great relief. I love it. Now, what about lockjaw? Here we go. Initial results using extracorporeal low-energy shockwave therapy in muscle reflex-induced lockjaw. The patients reported relief of their complaints, especially over the mandibular angle region. That's right here. Through the daily application of ESWT, and felt their condition improved after the 5th therapy course. This helped their ability to eat, drink, maintain oral hygiene, even kiss, for crying out loud. Great physiotherapeutic benefit is imparted by the use of ESWT in the clinical management of these and other cases of dentomaxillofacial practice. Hey, but what if there's arthritis in my TMJ? Can that help? Hold my beer. Protective effects of extracorporeal shockwave therapy on rat chondrocytes. Again, chondrocytes are making that healthy cartilage. Conclusions. ESWT was associated with a protective effect on cartilage and subchondral bone structures of the TMJ osteoarthritis by reducing inflammation, cartilage degeneration, and chondrocyte apoptosis. Yes, they can cause regeneration. And check out this study. Biological mechanism of shockwave in bone. ESWT promotes tissue regeneration. Oh, the love, the regeneration. Wound healing, angiogenesis, bone remodeling, and anti-inflammation. Are you getting excited yet? Is your jaw just already feeling relief just from hearing about this? Well, what about the competitors? Extracorporeal shockwave therapy for the treatment of osteoarthritis, a systemic review. Shockwave therapy had significant improvement in both pain reduction and functional improvement compared with placebo, corticosteroid, hyaluronic acid, medication, and ultrasound. We love all these things. Hyaluronic acid, it's great, it's healthy. Is it going to cause regeneration? No. Corticosteroids, is that going to give you regeneration? In fact, first do no harm, Hippocrates said. The first thing it does is it goes in and breaks down tissue and decreases the ability for you to build new cartilage. In fact, the Mayo Clinic said, watch out, because the side effects are cartilage damage, joint infection, nerve damage, tendon weakening, osteoporosis, thinning of the skin, etc. Why break tissue down when you can regenerate it? Let's complete the thought on your TMJ. You've worked hard at it. Let's get you from second base all the way home and feeling good again and using your jaw again and smiling again.